Welcome to our channel HASHMICLINICS.
Welcome everyone. Today we're going to be taking a close look at a remedy that I think can be a real key to unlocking some of your most stubborn, frustrating cases, Ammonium Iodatum. We're going to explore exactly when and how to use it, especially for those tough respiratory pictures that just never seem to fully clear up.
So let's set a scene that I'm sure is familiar to all of us. You've got a case. Could be laryngitis, could be bronchitis, and all the signs, the glandular issues, maybe even a scrupulous or syphilitic taint in the background are just screaming for iodine. You prescribe it, feeling pretty confident, but the case just stalls. Yeah, the patient gets a little better, but it's only partial. The core problem? It's still there. So what do you do now? Where do you go from there?
Well, this exact moment, this clinical dead end, is precisely where our remedy for today, Ammonium Iodatum, really comes into its own. Its number one indication, its absolute keynote, is for when iodine, even though it seems perfectly chosen, has just failed to finish the job.
All right, so let's really get into the heart of this. To truly get a handle on Ammonium Iodatum, you have to think of it as a compound remedy. Its entire clinical picture is this beautiful fusion of its two parts, the ammonium side and the iodine side. If you can grasp this duality, you'll be able to prescribe it with real precision.
You can really see this split personality right here. On one side, coming from the ammonium part, we get this profound weakness. I'm talking about a feeble, sluggish circulation that leads to total prostration and this really distinct, heavy, stupid dullness. Then, on the other side, from iodine, we get the deep-acting pathology, the glandular affections, the scrofulous miasm. But, and this is the crucial part, that classic iodine restlessness gets modified. It's dampened, weighed down by the sheer weakness of the ammonium.
So let's start by looking at how that ammonium signature shows up in the neurological picture. Because this is often where you're going to find your most valuable confirmatory symptoms, the ones that really pull it away from being just a pure iodine case.
And here it is. This is a classic keynote, right out of the Materia Medica. And it's not just about the patient feeling tired. This is an objective symptom you can actually see. You look for this heavy, dull, almost stupid expression. You see it a lot in young, well-fed people who don't get out much. It's just a powerful, powerful visual clue.
And that facial expression doesn't exist in a vacuum. It comes with this whole cluster of neurological symptoms. We see these dull headaches, really profound vertigo, sometimes even to the level of Meniere's disease, tinnitus, and just a general lack of coordination. An unsteady walk, a real difficulty controlling their movements.
So what's the thread that ties all of this together? It all comes back to one central problem, that feeble, sluggish pulse and poor circulation that's so characteristic of the ammonium group. It's like this low-grade, constitutional sluggishness that's underpinning the entire symptom picture.
Okay, now let's switch gears and move to the respiratory system. This is where you're going to see the iodine part of the remedy really shine through. In fact, this is probably what made you think of iodine in the first place.
Ammonium iodatum is not for a simple sniffle. We're talking about serious respiratory conditions, severe laryngitis and bronchitis, even the copious types. We're looking at catarrhal pneumonia and even the threat of edema of the lungs. These are deep, serious pathologies that need a remedy that's just as deep.
And this right here, this is the main therapeutic guideline. Honestly, if you only remember one thing from this whole explainer, let it be this. Ammonium iodatum is your go-to remedy when the respiratory picture is a perfect match for iodine, but iodine itself just isn't getting the job done.
Of course, as with any good prescribing, we absolutely have to differentiate. It's so important here, so we don't get it confused with other ammonium salts or even with iodine itself. So let's sharpen our focus a little bit. Okay, this table really lays it out. When you compare it to pure iodine, Ammonium Iodatum has that signature feebleness and prostration. A typical iodine patient is often restless, hot-blooded. They don't have that heavy dullness. And don't mix it up with ammonium tartaricum, which is famous for that dry, hacking cough after every cold, a much more acute picture. And yeah, both can be useful in syphilitic histories, but mercurius is going to present with its own huge, unmistakable set of symptoms.
So let's put this all together. Let's synthesize this information into a set of really practical, clinical pearls that you can literally take into your practice tomorrow.
So here it is, your 5-step mental checklist. First, you confirm the iodine respiratory symptoms are there. Second, and this is your way in, you see that iodine has stalled out. Third, you check the pulse. Is it feeble? Is it sluggish? Fourth, you look at the patient's face.
Do you see that heavy, dull appearance we talked about? If you can tick off these boxes, you can prescribe Ammonium Iodatum with a very high degree of confidence.
Now, what about posology? Well, the classical sources are pretty consistent on this. They recommend the lower potencies. The second and third triturations, the 2x and 3x, are specifically called out as being the most effective, so that's where you'll want to start. And that really brings us to our final thought. I want you to just think about your own cases for a minute. Think back to those stuck, scrofulous, or syphilitic patients, the ones who got a little better on iodine but never really crossed the finish line. How many of them really were just waiting for this remedy? For that very precise combination of deep iodine inflammation overlaid with that classic ammonium feebleness and circulatory weakness? It's definitely a question worth thinking about.
Professor Dr. Rafat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia, Medica, Respiratory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rafat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.